So they don't even really know what causes this yet. So how far are we away from actually finding a remedy with that?
There is no cure for it yet. It is a viral infection, and as Dr. Perez will allude to, it has a higher fatality rate than influenza, but less so than the SARS epidemic in 2003. And so just before we talk about the cure and before I turn it over to Dr. Perez for the fatality rate, I think with any viral infection, the first thing is prevention, and Dr. Perez mentioned hand washing, etc. The second thing is diagnosis. We mentioned the fact that currently there is a PCR that's available, but it's only being done by public health laboratories. Treatment. There is currently no treatment. There are drugs, like there is a drug called remdesivir that's being looked at. It's an antiviral drug used for Ebola, but it's just in very early phases, and they are looking at what is called a JAK2, a Janus kinase 1 inhibitor. And then the last thing is vaccine. The vaccine is also way down the line. There is no vaccine close at hand. So at this time, there is no treatment, and perhaps the best thing you can do is hand washing, as Dr. Perez mentioned, and prevention, because currently neither there is a treatment nor there is a vaccine.
One of the things that we want to make sure people are aware is a new virus. The data that we have about how fatal or what the mortality rate is kind of still in the initial stages to kind of know for sure. But just to give a comparison, is definitely has a higher mortality than the flu. The flu is around 0.7%. This virus, the mortality rate is around 2 to 3%. But if you compare to other coronavirus outbreaks that we had in the past, we had the SARS outbreak that had a mortality rate of around 15%, and other coronavirus like the MERS, the Middle Eastern coronavirus, had a mortality of 35%. So compare that to the 2% mortality so far known in this virus is relatively low.
Great, thank you so much. Really great information here. You did such a great job. Maybe we'll have you back again sometime. All right, Andrea, back to you.
All right, Rose, thank you so much, and thank you to our doctors from Lexington and Prisma Health. We are going to keep this conversation going, so continue now watching us for News 19 at 6, and we will keep taking your questions for the experts.
Thanks, JR. So one of the questions up there, how long from symptoms until, how long does it take for the symptoms to go away?
So the incubation period, that is the time that it takes for the virus to enter our body and then develop symptoms, is anywhere between about 14 days, although some studies are now saying it could be slightly longer, perhaps 20 days. And once the virus enters our body, people have looked at the amount of virus that is being shed in our sputum or in our nasal secretions, because that's how the virus spreads. It sort of seems to peak around day 3 or 4 or 5, but we'll probably continue to shed some virus for at least a couple of weeks.
So, but I feel like with this, the whole incubation period, how do you guys feel about this? Do you feel like it's inaccurate, or do you think that this will probably, I mean, I know there's a lot of things changing just with some of these, spot screenings that are going on.
So, I mean, the problem with the virus is we're very early into the epidemic, and there's still a lot of things that are trying to be figured out. So the incubation period, as Dr. Ahuja was saying, is kind of estimated from some of the other viruses. The cases that we had, have been evaluated, and there's been an estimation of, how long it takes to produce symptoms. So a lot of this is unknown, but one thing I want to make sure that is also understood is the prevention is key, and that's what we were emphasizing, the hand washing and using sanitizers, covering your cough. Because what we've seen is that this virus can be transmitted even in asymptomatic patients that don't have any symptoms. Right. And also, even after you had the disease, you can shed the virus, you can spread the virus too. So the 2 weeks is the safe way to say, probably that's the right amount of time, but the truth is that we probably have to change that as more information is made available.
I see a question over there. I just think it's kind of interesting. Can you have the coronavirus and the flu at the same time?
Sure. Viral infections can happen together, they can happen separately, they can happen on top of other infections, or a bacterial infection can happen on top of a viral infection. So yes, two infections can happen at the same time, but if somebody as of today in South Carolina or around the southeast of the US gets a flu-like illness, it is much more likely to be influenza.
Okay.
And far less likely to be the novel coronavirus. And so put things into perspective, most likely influenza as of today. Will this change in 2 weeks' time? Yes, that's possible. But as of today, if somebody in your house gets a flu-like illness with fever, shortness of breath and cough, it's more likely influenza A or influenza B, much less likely to be the novel coronavirus.
That's a really great point.
All right, so this is coming in real time. We appreciate you submitting your questions, and this is what a student wants to know. Is it safe for U.S. graduate students to proceed with plans to study abroad in London in May of 2020?
I'll take that one. So, I mean, the outbreak is definitely more intense in the United Kingdom than it is in the U.S. But in the overall risk of what can happen if someone goes to London or the United Kingdom, probably getting the coronavirus is very, very, very unlikely. So I think that if it was my daughter or my son going to to a European country, I'd probably say, okay, you can go. Just be careful. Use all these preventive measures that we're discussing. I wouldn't say the same if it was going to some of the areas where there's many more cases, like China right now, or the northern part of Italy. So that would be probably different. But I think that in general, like traveling to London would be okay.
Doctors, we want to know, is there anything a person with an autoimmune system problem or a respiratory problem needs to do as an extra precaution?
So autoimmune system problems, some of these patients are on medicines to suppress their immunity. So they are more likely to fall sick from if they have an underlying autoimmune problem. If somebody has underlying emphysema or chronic bronchitis or COPD, yes, if they get a viral infection, they're more likely to fall sick. There is actually some data coming out of China that all those who've died, of the patients, about 2.3% fatality rate, most of those who've had serious outcomes are older people or people who develop what is called ARDS or severe respiratory illnesses. So older people with other comorbidities, heart failure, emphysema, are more likely to have a serious outcome of coronavirus than an otherwise healthy person.
We have a lot of diabetics in this community. What are your thoughts on that?
And so diabetes itself is a condition that drops your immunity down a little bit. So yes, they are at slightly higher risk. We don't know how much higher. In the swine flu, or what was called the swine flu epidemic in 2009, the risk factors for serious illness were older patients, comorbidities, pregnant women, obesity, and very young kids. But as of in this outbreak, only older patients with comorbidities have had bad outcomes so far.
So far.
And if I can mention something real quick, to segue into this, if you're a patient that is at higher risk of catching this infection and developing a bad outcome, there's two things we haven't talked about yet, but vaccines are very important to protect yourself from other respiratory infections. So the flu vaccine, you should get it every year, and if you're a diabetic or have some of these chronic heart or lung conditions, you definitely should be getting your pneumonia vaccine as well.
Great. Thanks, Dr. Perez. Darcy, back to you in the monitor.
All right, Rose, we, again, as I just mentioned, are getting these questions in real time. I've got to step off here and click so we can get the newest post up. Let's see if we can get that to come in. What if you have asthma and you can't wear a mask? What are the options for those patients?
So if you have asthma and if you think you're at risk of catching an infection, we're not talking about the N95 respiratory mask for patients. What we're talking about is the yellow surgical droplet masks that are slightly easier to tolerate. For healthcare providers and people caring for these patients, it's recommended they wear the N95. But I think in general at this time, nobody has to rush to CVS or Walmart or Walgreens to buy masks. Number one, you won't find them there, and number two, panic doesn't help at all. So at this point, there is no need to rush there and buy these masks. Just hand washing, and good hygiene is probably the way to go, and not touching our faces all the time, which causes us to get the virus.
Great. Thanks so much, Dr. Ahuja.
All right, Rose, these questions are coming in quicker than I think I can even keep up with them, but we know this is a new newscast. There are people who are just joining us who weren't with us at 5 o'clock. So for those of you who are joining us for the 6 o'clock hour, 803-776-9508, that is the number to text in your questions. Infectious disease doctors are here. They're giving you the bottom line on the truth about the coronavirus. We don't need you to panic. We need you to be informed. And here's another question just coming in within the last minute or so. Does having the flu shot make it harder for you to catch the coronavirus versus someone who did not get a flu shot? Doctors?
So the answer to that is that we don't really know, because there are different viruses and the vaccines are specifically made for one virus or the other. It is true that some vaccines, because they stimulate the immune system, can rise your antibody levels, and that may have a moderate protective effect against other viruses. But what I would tell you is get the flu shot and you won't get the flu. Once there's a vaccine for the coronavirus, you may get that vaccine too if it comes to that, but probably the flu vaccine is not going to necessarily help you to prevent this infection.
So with the vaccines, is there anything else that people can do on top of the vaccines to keep their immune system healthy? Is there anything that any thoughts on that?
I think just, I think healthy eating.
Right.
Avoiding smoking. Smoking is a risk factor for respiratory illnesses and lung disease. If you're a diabetic, keeping your sugars under control, and staying away, and hand hygiene, respiratory hygiene, and staying away from, if you suspect somebody has an illness, and if you have asthma, best to stay away from them as much as possible. You can't stay away from your children. You still have to look after them, or from your parents, but at the same time, just some sense, just some common sense, and finding a sort of a balance between caring for your loved ones and staying away.
Great. Thanks so much, doctors. Darcy, sending it back to you with the monitor.